everybody. Those who are watching from the MMA Facebook group and the DOPS Facebook group. This is our third edition of Meet the Candidates. This time it's for the post of Honorary General Treasurer. And with me to introduce the candidates is Dr. Ashok Philip once again. Ashok, thanks for co-hosting. And
thank you.
Let you introduce the candidates.
Thanks. This session, we are introducing the candidates for Honorary General Treasurer of MMA. Very important position. So there are two candidates for one position here. Let me first introduce Dr. Vasu Pillai, who is a consultant hepatobiliary surgeon and who has just recently moved into private practice and is based in Penang, and he will introduce himself shortly. And the other candidate is Dr. Ravi Venkatachalam, who is a medical officer in private practice in Kuala Lumpur. And he's also been very active in KL. So let me ask Dr. Vasu to present himself and his vision for the treasurer.
Good evening, everyone. Thanks for joining. I'm Vasu Pillai Lechumanan. I'm going for General Honorary Treasurer post. I've been active in MMA since student days. I started my journey in MMA in Kelantan as a student member, then subsequently has continued. After my specialization, I came into the administration of MMA. I joined Kedah State and served in various committee positions in Kedah. Subsequently, I became Kedah chairman for 2 years. I've done a lot of projects in Kedah. I've increased the membership number in Kedah at that time. We had a wonderful team working together and achieved, even brought Deputy DG to Kedah for R&R session there. Subsequently, I became SCOMOS chairman for 2 years. I had a wonderful team as well. Worked together on many projects. We encouraged many junior members, engaged many junior members to join. Brought forward a lot of issues, including specialist promotion issue, JUSA, medical reports, fees, and many others through MBK. Then I became a deputy secretary. This is my third year under deputy secretary. I'm well versed in many of the issues affecting doctors, welfare of doctors, and we do fight through our system in multiple ways, through many prongs, and approach the government of the day in many ways to solve the issues. And currently, I also serve in many committees, including Computer Technical Committee, CPD Committee, Building Committee, Insurance Committee. I'm coordinating the MPS insurance as well. And I was previously chairman of the Computer Technical Committee, served 2 years, and headed the project to create the current software that we have, the app that we have, MMA app, with the help of all the IT committee members as well. And I hope for your support to continue my service for MMA. Thank you.
Thank you, Dr. Vasu. Now let me call on Dr. Ravi Venkatachalam to say his piece.
Hi everyone, I'm Ravi Venkatachalam. I'm from KL and going for the post of Honorary General Treasurer. And this is my very second attempt, which last year I didn't make it. Right. Tell about myself, I've served in my committee in Wilayah from the year 2011 in various posts, and as a committee member, PPS representative, and I'm currently the treasurer of the branch, which will end by this month end, and moving up to the post of vice chairman of the branch. And during this tenure, last 2 years as a treasurer, I have brought in a lot of revenue into the branch, and we are in the midst of purchasing a building hold some cash with no loans taken or borrowings from the HQ, and that will be tabled during the AGM for approval of by two-third majority. Okay, and our branch is fully supported and endorsed it. Under the MMA committee, I'm currently serving in CPR committee in integrative medicine, and also in the constitution resolution review committee under chairmanship of Dr. Ashok, uh, very much that you can see here. Okay. Also pledge my support to bring in more revenues to get elected to the association, and also minimize and maintain the essential expenses of the association. I believe this is the important task of any treasurer in any organization in particular. Right? And another note, I work as a senior medical officer in a private hospital, which is very close by to the HQ, and I am accessible most of the time if I get elected to what is needful, and I pledge my support to do the best in the post. So with this, I'm taking this opportunity to thank all of you who are listening to both of us, and then hope to get the support from you all to get me elected. Thank you very much.
Thank you, both of you, for being admirably brief and yet clear. So right now, let's see whether anyone has any comments or questions. But first of all, if I can ask both of you, Ravi first and then Vasu, what is your idea of the current processes right now for controlling expenditure and the processes by which expenditures are approved in MMA? Have you got any ideas about that?
Yeah, very much anticipated question. Thanks for this question, Dr. Ashok. Okay, how to start with? Okay, right now with COVID that has come in and it's still being in, everything has moved to virtual, and this is actually a game changer actually. And many of the meetings have gone virtual, including our branches AGM and also the upcoming national AGM. So thereby, a lot of expenditures being cut, and we can do everything right from our home, workplace, or any other suitable place to join in. So what was given to the members who joined in the virtual was a plain RM 100 ringgit for those who are logging in from any part of Malaysia. So I think that's a good way to look at it, not only because of COVID. I think going forward, we can have a hybrid system where the office bearers can hold the meeting physically. With those who can attend, it is most welcome to attend, and then everybody is given a fair chance to attend. And I mean, I see the audio and video is quite clear, and it's very comfortable for people to join in and do things right now. I think that way the expenditures can be brought down drastically, and it's already shown proof. Does that address the issue?
Thank you. Vasu, any thoughts on this?
Okay, I think your question was about the processes, how the approval of finance is being done in MMA. So as I've been in the Exco and Council for some years, and worldwide we did, there are certain amount which can be approved by Secretary and Treasurer, whereas up to 10,000 can be approved by the Exco approval, and subsequently up to 250,000 can be approved by the Council. The treasurer is to present the financial requirement to the council for the approval. When the majority approves, that particular expense can be approved. And anything beyond 250,000, we have to table it in AGM. Yeah. Otherwise, regarding the financial status, I think the main issue, yes, COVID has cut down a lot of our activities. We end up paying a big amount of tax actually this year because of probably reduce in activities, and the taxation has been calculated a bit differently. So my aim will be try to encourage more activities involving the members, and try to cut down on the payment of taxation. Yeah, thank you.
Right, as you can see under the screen, there is a question which is directed, I think, at both of you. So I'll ask Vasu to go first on this question. As a custodian, what are your ideas on raising income?
Okay, as we have been for many years has been dependent on income from insurance. Our membership fee is just to sustain a small amount of expenditure only. Actually, our main income has been insurance, but since the internal auditors has been advising us for last few years, I think the Exco and Council has taken various steps to increase our income. We have increased our income through CPD activities. We have increased our income by having registration fee for the fee scheduled by MMA. And we also have various fixed deposits and rental from the MMA building as well. But to go forward, I think we have to organize certain activities that we can contribute financial aid to MMA as well, such as conferences. We can engage various doctors group, and we can provide certain trainings as well. And this could become additional income for MMA. And also we can expand the CPD activities. This is one way of expanding the income of MMA.
Thank you. Ravi, your thoughts?
Yeah, as how Dr. Vasu pointed just now, all those are the incomes that are coming in all this while. Mainstream of income is from the insurance, but these are all pre-existing incomes that have been created by our very seniors from the beginning, and it is being maintained somehow very well by the efficient team under the finance side of HQ. And we need to look at more new sources of income. Like what they mentioned, I think it's a common thing to mention that we need to have more seminars, conferences, and ongoing things. And this is what we did in our branch level. We had resources already in our branch when I joined in 2011. But the first few years, we had to break some FDs to maintain also. But after a while, we started all the activities that started generated income, and our CPD also went very high the last 2-3 years. I mean, this year is affected by COVID, I understand, and it was converted to webinar. But otherwise, our regular seminars has actually brought in a lot of revenues, and with which collectively we are able to do things what we want to do right now. So I think a new source of income, I think what Dr. Arasu has brought in the eMed Asia under COOPS, and with the partnership with the MSCM, I think they're doing quite well. I think everyone should take the opportunity to join the co-op and also support it. And I mean, that's one big source of new income that is coming. I think we should look into that to encourage more members to join in. And maintaining the previous incomes that are coming in, I think it's not a big issue or headache for anyone, because it's already been preset and it's running on autopilot and, until nothing happens. Okay. So that's my thoughts on it.
Okay, that's another question, but before more questions come in, can I ask you all to click on in the description for the videos being streamed live to both Facebook groups. There's before leaving a comment, grant StreamYard permission to see your name. So if you don't grant StreamYard the permission to see your name, the commenter is anonymous in our, so if I click, this is actually from Dr. Kevin, and his question is, what about new ideas for new income streams? So if Kevin, you've given your StreamYard permission to see your name, then your name will appear there. Otherwise, you're just Facebook user. But it's okay. We can still see the comment.
Okay, but before asking either of you to answer the question, I just want to just correct a slight misconception. The co-op MMA finances and income are completely separate from MMA finances and income, though co-op will pay a small amount to MMA when it starts making some money. Okay, so this time Vasu has answered the earlier question, so I'll ask Ravi to start off about new ideas for new income streams.
Yes, Dr. Ashok. I think organizing seminars and conferences will be one. I mean, one regular source of income for the association. And I believe this year beginning we had a program organized by Dr. Bhaskaran in NLFCS, and that should be continued for year after year, because that also brings in source of income. And we should look into other ideas also, other than going into the public media and things like that.
Thank you. Vasu, your thoughts on this matter?
Yeah, so it's almost similar question compared to the previous question. But just to clarify, CSR is one of the good activities which brought in income, but we are using that for charity purposes from MMA as well. It has brought in a very good income. Also, we are trying to modify our MMA app at the moment to get more revenue through online CPDs. It is not from payments from doctors actually, but through other methods, by vendors, by advertisements, which will be having a new facelift hopefully by end of this year. We will be able to launch it to generate more income for MMA through that. And of course, as I answered before, through seminars and conferences, we can increase our income as well. Many of the subcommittees previously has organized many activities like anti-smoking committee, adolescents committee. So their conferences, as even last year, one committee organized international level, and probably it was a first experience. We couldn't generate much income, but as years goes, I think MMA can encourage and streamline these conferences to get more income. Thank you.
Okay, thank you very much for that. Yeah, I think traditional income streams are going to become problematic. You can't let them become too much of a proportion of our total income, and we have to start looking at non-traditional means. I think since we do have the app, we have to look at the ways to monetize it without making it a burden on the users. That's what we have to emphasize. The users, the doctor community, cannot be paying for that. Now, we have, as you see, another question. Any ways to increase the membership benefits from the treasurer's point of view? So, Vasu, please. Okay.
To increase membership benefits from treasurer point of view, I think since SCOMO's time itself, we have added in a lot of membership benefit for the members. We have brought in corporate companies giving car discounts, hotel discounts, and many of it done through previous treasurers as well. And we have a lot of privileges for members, even certain restaurants giving discounts. These are the ways membership benefits, and even AirAsia. We are partnered with AirAsia. Some amount of discount was there for members applying through certain websites. I think a lot of life members has benefited from car purchase, Mercedes, BMW, and so on. So there are many benefits for members for MMA. And of course, being life member, it is not only membership benefit. As a member, I think we all going to contribute to the welfare of doctors if we unite and join as a single body, support as a majority, and we can put our demands better with the government or related agencies, and will become a big voice, so that will benefit all the doctors and members as well. Thank you.
Okay, Ravi, please.
Yeah. See, MMA has now become a very popular thing, and everybody is aware of it. And moreover, currently for this year, nobody can renew the APC without indemnity insurance. It has become compulsory. So, though the process of doing it online is a bit tedious, from what I heard from many, and indemnity insurance for all the GPs and also the private hospital doctors also, it's all become a necessity right now. So, uh, I mean, membership is just it's a piece of cake. Everybody will become a member very soon or later. Of course, through all the seminars, activities, the social events, and everything, we can always encourage people to come and join our activities, and thereby they can just become members. We always have a member rate and a non-member rate, and then going forward, the second, third time, they will just become a member in all the activities. And I think that's much to add on it, like what was said earlier. Thank you.
Thank you.
Dr. Ashok, can I add in some more?
Yes, sure. Go ahead.
Okay. I think even in Kedah, when I was a chairman, we gave very good intensive incentives to junior members to attend physical AGMs at that time. We encourage a lot of junior members to join activities with the discounted rates. So these are the ways we can give benefits to the members. And as I stated, we are paying a huge amount of tax from MMA, and by increasing membership activities, which can benefit team building and benefit the members, either clinical or non-clinical, we can increase the benefits to the member. Yeah, thanks.
Dr. Ashok, just to add one more, I mean, that's the same thing which we've been doing last 3-4 years also in our branch. We have the team building, family day, overseas trip and everything for the members' benefit, and actually we get to spend money this way positively. I have to bring down the taxes to an level, but our income, if it goes a bit further up and the expenses less, I mean, there's no way to evade tax. We have taxpayers anyway. So the more income, the more tax to be paid. But there are ways and means to do it. That's where the tax consultants and other people come in. Thank you. Just to add on.
Okay, as you can see, there's another question there from Facebook user saying that our staff, especially IT staff, have worked very hard to carry out virtual meetings and AGMs. That's very true. And do you think we should reward them? Ravi, please.
Yes, they should be. I'm not sure what was the reward given to them or the monetary benefits and other things, but I think they deserve a big hand on that. They should be given for the workload, including Dr. Allen and Dr. Ashok, who's doing much work to moderate this. And I think Dr. Namazi and Dr. Ashok, Dr. Arasu was in the scene also, conducting all the branch AGMs. And so they deserve a big hand and rewarded accordingly. That's what I have to say.
Yeah. So it's not only the IT team, also quite a number of secretariat staff were involved in all these virtual meetings and AGMs. Actually, the council has awarded them additional financial benefits, as well as there is a secretariat welfare committee in MMA, which will consider bonuses according to their performance And definitely this year, the IT staff and those involved in all this will be considered for the better bonus and increment, actually.
Thank you. So, as you can see, there's a question from Dr. Murugaraj on how to cut down some of our expenses as income is also down. Vasu, please.
It's not true that our income has come down. Actually, as I explained earlier, we have included various ways to increase our income through CPD, through fee schedule. Thanks to Dr. Namazi for that, and also through various sponsorships. We have actually increased the income, and due to COVID, probably our expenditure is reduced. Also, the council and Exco has been very cautious in spending. So the net income has actually increased, and that's probably contributing high taxation at the moment. So I think we have to balance it out, and the council has been very prudent in approving expenses, actually, all being monitored according to the SOPs available, and the president also on it as well. So I don't think we are having a big problem at the moment. We are not cutting down our income. Of course, we need to spend what is needed and benefits the members and the benefits MMA. Thank you.
Thank you. Ravi, your ideas on this?
As I mentioned earlier, I think virtual meetings and hybrid meetings is the way to go, and that naturally cuts down the expenses to a big level. Okay, and then income. I think, as I know, all the pre-existing modalities are working. Only thing, rental has, I think, had been decreased by 30%. I'm not sure, because some of the companies, if they are not SME, they are not even allowed to get that 30%. So other than that, I think income was already there. I mean, not to repeat what are the streams of income that we have. We already mentioned it earlier. Cutting down the expenses will be mainly to follow what we are doing right now, the hybrid meetings. That's the way to go about it. Any other thing I can't seriously think of. And we need to have some necessary expenses. I think that is also there. We have to strike a balance.
That's true. Okay. So we have a question about the economic situation, the bank loan moratorium coming to end at this end of this month. So how can MMA assist GPs in terms of new streams of income that GPs can participate? Ravi, please. Ravi.
Yeah, I'm just digesting the question. Okay, probably Dr. Vasu wants to answer first. I'll just give a thought and answer that later.
Okay, Dr. Ravi, no problem. So post-COVID with bank moratorium coming to end, yeah, a lot of GPs actually is facing the problem of decreased income. It's not only the GPs, also private specialists. Many are affected actually because of this COVID, definitely under the healthcare. And one of the ways is, of course, Koperasi MMA. I'm one of the board members there as well. So Koperasi MMA is as this eMed Asia, where we are bringing in a lot of discounts on the products. Can join and purchase from there, as well as PPS has been negotiating and insisting the government to recognize GPs for to be a partner in healthcare. Probably to run GP services like monitoring hypertension, diabetes, primary healthcare. GPs can be engaged in a way to give out this treatment, and also in COVID tests. MMA has been pushing ministry to recognize GPs and to get GPs to do the tests for screening for factories and factory workers and many other companies. I think we have to push through this. This can assist in increasing the GP income. Thank you.
Thanks, Ravi.
Okay. Yeah, I know. During the COVID pandemic, I mean, the current pandemic right now, many GPs affected by the screening process. There was red tape and at various level when the government started the COVID screening first, and then it was passed on to the private hospitals. And when it came to the private hospitals, it is we, the senior ER officers, were doing nationwide all the screening and not the specialists like we, whether inpatient, outpatient, PUI cases and everything. So anyway, we did our part on that. And at the third level, which is supposed to have gone to the GPs, it went to the, unfortunately, to the hands of one lab. I think it is, I mean, no harm telling the name of the lab, a BP lab, and it was monopolized by them, and that screening was not even done according to standard procedures and whatnot. A lot of long queues in the roads and everything, and it was a big mess. And it didn't come to the hands of the GPs to do it. And I know my GP colleagues all over nationwide, they are very unhappy with that. The income which they are supposed to get through the screening has didn't reach them. And of course, now with the new thing which we mentioned earlier about the EMED Asia, and right now Vasu also mentioned, I think that is the way to move on. At least the antibody testing kits and things are coming into place for them to do. And that's the main thing that got affected during this COVID time. They have to look at other ways to generate income. I mean, the COVID will pass. It will pass away. Maybe by the year end, it will pass away. So they have to look at other ways to generate more income, like making use of the EMED Asia's platform, which is a good thing that has been started by the co-op. That's what I have to say.
Thank you. Just to mention that EMED Asia is not just discounts on products, but also financing modalities from participating banks. Okay, now there's another question on how MMA is paying so much in income tax. So the honorary treasurer should look into ways to spend the money to benefit the members in balance with a healthy savings plan. Would you like to comment on that, Vasu?
Yes, yeah. As I mentioned earlier, this year, due to a bit different tax calculation, we ended up being taxed a huge amount. And the current council and the current HGT has looked into this as well. And we have identified areas where we need to increase some expenditures by end of this year, so that next year taxation we can cut down on the taxation. Also, we are consulting with a tax consultant as well, and currently we have a very good tax consultant. With the help of the tax consultant, we will be able to cut some amount of tax next year. Yeah, this is a very valid point, and we have to take seriously. The coming AGT has a big task on this, and to channel away the money towards the members' benefits.
Okay, thank you, Vasu. Ravi, please, your ideas.
I was actually told that the current taxation 28% will apply for next year to all the branches. At a point of time, they wanted to separate the tax numbers for branches, but it was rejected by the LHT, and this is what I was informed. And now they have given a prorated taxation for all the branches. So that's how it has gotten us a bit of relief. But next year it will be a flat 28% for all the branches, so irrespective of whatever big or small or moderate amount they generate as an income. If there's no income, then it's okay there. There's nothing to pay in tax. Okay, membership benefits are the things that we have to look at, what they get, right? Many of the activities that can be utilized from the income to actually show as an expenditure is the way to do it. Yeah, that's what I have to say.
Okay. Just to explain further, the taxation, we can't have a different tax for different states because we are registered as the main body and with one registration number under ROS. So the LHDN follows that number, and all the states has to pay tax under the same registration number. So even though, let's say, a state makes a small profit, but they end up paying the 20% tax, actually, that has come into calculation this year, and that has increased our tax tremendously, and this is going to go on for next year onwards as well. So as I said, we have to identify the categories where we can maximize the expenditure. There are certain categories like IT, renovation of the building, membership activities, all has a certain limit to it. But I think we can maximize on this and benefit from that. Thank you.
I think everyone can agree that we need to cut down on tax.
Yeah.
Legally, of course. No evasion. Right. Are there any more questions in the pipeline, Alan?
Well, I think nobody has asked any questions. I don't know why people are not so keen to ask. Maybe that's not many questions you can ask about finances.
True. Think about the important things for how we are going to help GPs who are going to have a very tough time over the next 6 months to a year at least. And at the same time, also how we're going to cut down our inflation and unnecessary expenses. I think you've answered, both of you have answered your points of view on this. So thank you very much. Alan, thank you for arranging this.
Yeah.
We'll be having, yes.
No, you're going to announce next week's one, is it?
Yes, on the 15th, isn't it?
14th.
No, 14th.
It'll be next week, Monday. We are just having for the president-elect tomorrow night, then I think it'll be Monday week.
The 14th of September at 8 p.m. be able to meet the candidates for president-elect. That is 4 people. So I hope.
I can't show you the events more than the week before the actual, so it doesn't appear yet in the group. So when it does appear in the Facebook group, what you should do is hit the get reminder button. All right. Otherwise, you might miss it, and you won't get noticed. The things can flow very fast, especially if you have lots of fans or very busy feed. So don't miss this chance to ask the president-elect. Hopefully that's the biggie next Monday on the MMA. For those of you who are not members of MMA yet, also you can ask the president-elect why you should join MMA. I confess I was a little bit of a passive member for quite some time. Actually, once you get into the MMA, you realize how much hard work all your colleagues have been putting in. You know, all the sacrifices, all the people who are in the various committees. But not, nothing more than actually what you as members actually should do also to help your association. I think there's a lot. It's a two-way thing. Yeah, you have to help the committee, help the people who are leading as well. But if you're all quiet, nobody's having any voice, then I think the profession will suffer. There's one more question, Ashok.
So somebody would like to know, if you are elected as the next HGT, what would be the one thing that you would change in MMA? So I'll ask Ravi to answer that question first. You're muted, Ravi.
Okay, it's a very good question, but I have to give a serious thought to this. There are many things to change anyway, but change is not the only question. I think I have to enter, study the place, and go with the flow, work with the team, and actually see what is the current positive side of it and the negative side of it, and enhance the positive side and bring out the negatives, what is happening, and then try to look at a way to work on it. It is very difficult to pinpoint and the questionnaire to say which one particular thing needs to be changed. It's a lot of things over there. So we have to enter and actually look at the issues in hand one by one. Okay, that's all I have to say for this.
Thank you, Ravi. Vasu, please.
Yeah, thanks, Dr. Ashok. It will be maintain the income and reduce the taxation, as I said. That will be I think, the one thing we need to do as a HGT in this case. Thank you.
Or increase the income.
Maintain the income or increase the income. Yeah.
An increase. Okay, so great. You can see both of you have got your ideas and your points of view. Of course, there's a lot of overlap because in the end, the benefit has to be to the members of MMA and to MMA itself. So it's clear that many things have to be done as they are being done now, but at the same time, you need to look at new avenues to reduce taxation, increase membership, increase benefits to members, and increase income. So thank you very much for sharing your views. And I hope you guys will also drop in next week when the president-elect candidates are there and ask them what they're going to do. Thank you very much.
Okay. Good night, everybody. Yeah.
Good night.
Thank you very much, Dr. Ashok, LNP, and good luck to you, Vasu.
Yeah. Good luck to you, Dr. Ashok. Thank you, Dr. Ashok.
Thank you to you.
Welcome.
Thank you. Thanks.
Good night.